house, you know.
Sorry, I'm going to record this, Chantel. I should have,
Oh,
you know,
you're fine.
probably,
You're fine.
but I didn't think you would mind.
Nope, I don't mind at all. I want
That
to
way
make sure
we have a YouTube channel, so I can put it out there for our volunteers.
yeah, no, you're great.
Thank you.
So thinking of a fictive kin, like I said, would be a teenager living at their friend's house, and those parents are responsible for that child, and they're now fictive kin. They're the fictive kinship parents for that child. So these are what we're looking for to serve, these kinship families. I myself am a kinship family. So I have two biological children who are 20 and 17. So fun. And we adopted our little girl who's not so little anymore. She's 12, about to be 13. But we adopted her when she was 3. And about 2 years ago, we got a call that my husband's stepsister's children were being removed, and they had searched through the family, and we were the call that was made to go pick up in Kansas, in the state of Kansas, my niece and nephew, who are 14 and 10 now. So 12 and 8 at the time when we got them. And so we've quickly realized that we were going to be caretakers of our niece and nephew. And what was interesting, what happened with us, and it's the story I hear often. I know you as CASA work with families who have open cases, which is amazing. And those families need services as well. But what happened with me, and what we see with a lot of families, is CPS removed and said, okay, great, they're in a safe home now. Best of luck to you. Bye-bye. And that was it. And the case was closed. And so we picked them up, came to Texas, called Protective Services in Texas and said, what do we need to do? And they said, nothing. You guys are good. But, good luck to you, and enjoy your family. And so we're stuck figuring everything out on our own. And that's really what we're trying to do here. This kinship program is meant to come in and fill the gaps for families, because kinship families are far different than any other adoptive or foster family. I say to my friends who foster all the time, yes, but your bio parents, the bio parents of your children, don't know where your house is and don't show up on your porch for holidays. We do. We have that. So this grant, this funding is provided by the Family First Prevention Act as of 2018. So it's to support prevention services. So it gives states and tribes the ability to target their existing federal resources into an array of prevention services and early intervention services. This provides support for kinship and relative caregivers. So it provides federal funding for evidence-based kinship navigator programs. And so far, there are no evidence-based kinship navigator programs, but that's what we're trying to do. That's what this planning grant is about, is planning and creating a program that can become evidence-based to get that federal funding for the state of Texas. And we're not the only state, obviously, trying to do that either. So Family and Youth Services is provided by Real Help for Real Life with ACH. So our prevention and early intervention and funded program provides free counseling and skills to families ages 6 to 17 in all 254 counties in Texas. So for Hill County, here at ACH, we service free counseling services. That's 6 free counseling services to any family, regardless of, there's not like a financial qualification for that. So any family that you're working with, that you're serving, we have free counseling services for them. And that might look like group counseling, individual private counseling, family counseling. We also provide life skills courses and parenting training courses that happen regularly. So a family could essentially be served for quite a long time as they go through all of these different programs that we provide. So as you see, Real Help for Real Life is the program funded by PEI, and we serve Tarrant, Parker, Palo Pinto, Johnson, and Hill County. So in July of 2020, the Real Help for Real Life program at ACH applied to be a part of the Kinship Navigator Planning Grant, which is funded through DFPS, or was selected by DFPS. And we were awarded the grant in August of 2020 to access and to assess, and develop a resource guide in those counties. So one of the things that we've done over the last several months is to create a guide of resources for families within each county, and really thinking specifically about kinship families, the kinds of services kinship families need, and the things that I'll tell you in a moment. We have a assessment, a strengths and needs assessment that we've asked every kinship family that we've come in contact with to fill out. And we're really able to look and see what are the things in each county that families are saying they need. What are the services they're looking for? And then we're able to create a kinship resource guide in that. And that actually is being put on our website right now. So you guys will have access to that very soon. And I'll make sure the website goes up on the screen at the end of this, so that you can provide that for your families. And I know you have those many of those resources, but it's just another resource for you. So our purpose for the Kinship Navigator Planning Grant is to figure out how we can assist kinship caregivers in learning about, finding, and using programs and services to meet the needs of the children they are raising and their own needs, and to promote effective partnerships with public and private agencies like yourselves, to ensure that kinship caregivers and families are fully served. Because I know firsthand how hard it is to be a kinship caregiver. So we're trying to coordinate with state and local information and referral services. We are planning and consulting with kinship caregivers and kinship-focused organizations. We're establishing information and referral systems that link caregivers to one another. So we're doing that through support groups. We're linking caregivers to one another based on their zip codes and support groups. And we're linking them to benefits based on their county, and to program information, and to training and support. So we're doing parenting training and podcast, book referrals, just things to help support and train parents. And then also connecting them to legal services. And again, you're working with families that already have legal services, but this is one of the things we're doing. And we're also outreaching to kinship care families through a variety of methods. I have done everything from standing at food banks and handing out flyers to connecting to senior centers. And we're promoting community partnerships and educating the community members about the needs of kinship caregivers, because they are unique. And we're trying to provide ongoing support and training for these kinship caregivers. And like I said, through our support groups, some of the things we're doing are some TBRI training, which is trust-based relational intervention training for these families as well. So how are we figuring out what kinship caregivers need? We're doing this through an assessment. We have an assessment that is utilized to identify kinship caregivers' needs through our communities. And through the process of collecting this data, we're able to establish the programs that best meet their needs. And so there are two surveys that we're having people fill out. One is for kinship caregivers, and one is for those community service providers like yourselves who might work with kinship caregivers. So those are the two assessments that we're providing. We are utilizing data from those assessments to identify resources that meet the needs of the caregivers in each county. And then we're completing a resource guide for online access. This will be online this month, hopefully in the next couple of weeks, to be utilized by kinship caregivers and providers like yourselves to share. And we're providing brochures and postcards and mail outs. And then we're also, those resources will be listed out by county. So for you, for example, if you have a family in Hill County, you're going to click on Hill County. You can click English and Spanish, and then you can go directly to the resources you're looking for, clothing and food resources, or perhaps you're looking for behavioral health and counseling therapy resources, and you will be able to click on those from there. One of the other things that we're creating, which will also be on the website, is a what to expect guide. We kind of said, foster families go through lots of training to prepare for children to be in their home. Adoptive families, tons of training. If you're having a baby, you are reading what to expect when you were expecting. But kinship caregivers, they're not going through any training, and they're not expecting. They get a call and they say, man, that's my family. We have to go. And so they go and they take care of their family. But they have no training, they have no resources, and they have no idea what to expect. So we're trying to create this guide, which also will be on the website, that we'll be updating regularly, that provides information on how to get services like Medicaid, TANF, SNAP, information on school enrollment and accommodations. One of the things we hear from families who don't have open cases, like myself, I had to fight the school system. So how to claim McKinney-Vento, how to say my kids have a right to an education in the county, in the city that they live, and get them enrolled in school. Recommended readings and blogs to listen to, online trainings on trauma, parenting, and child development is listed in that guide. Free online technology training through Goodwill is in that guide. Local online and Facebook support groups. So there are Facebook support groups if you just kind of want to be able to chat with people and dip your toe in the water, but you don't want to do more. We have connected to online Zoom support groups through Grandparents Raising Grandchildren, which has Zoom support groups for kinship families. I'm not a grandparent, but I'm a part of that group, and there are other non-grandparents. It's for all kinship caregivers. And then we also have local support groups that we're connecting people by their zip code through those assessments to connect to one another and have support groups. And then we also have recommended documentation in that guide that is needed for kinship caregivers. So the kind of documentation they need, and then the paperwork. We have a power of attorney form that they can print, download, get notarized, and have their child sign, so that they have that for their grandchildren, for example. We're also building on peer support, like I said, through the support group. So I said that we're collecting data by zip code and connecting them together. We're partnering with community centers, churches, and other organizations that are willing to house them. So perhaps you're willing to house a support group out in Hill County. That's great. And we would love to do that. And like I said, we're partnering with Grandparents Raising Grandchildren as well. I'm going through so much information. Please feel free to throw your hand up and ask a question if you have one, or we can talk at the end as well. But really, the ultimate goal is to create a program that utilizes the awareness and identifies the needs, and leveraging those partnerships with community organizations. So we want to increase awareness and access services. We want to hear from the community, both kinship caregivers and stakeholders, regarding the ongoing needs. And then we want to strengthen kinship caregivers through peer support, because we really think that's one of the biggest pieces of the puzzle. And I'll show you the data that we've collected. But we want to help them feel like they're not alone and have that peer support to walk through it with someone else, and create a community collaboration for kinship families. You can help us by completing the assessment as a community stakeholder, as a community service provider, and I will put that link up. Keep us in mind as you interact with organizations that can provide support to kinship caregivers. So you're on the field, you're working with kinship families. I'm sure you've come in contact and worked with some kinship families, and you might know of things that we don't know about that has been helpful for families that you've served. I would appreciate, just that interaction between us, and then helping connect us to kinship families that you're serving, so that we can continue to walk that journey with them after your time with them is done. And I know CASA really is phenomenal about staying connected with families, but we want to connect them to support groups. We want to connect them to peers. We want to connect them to training and those services. So again, there's the assessments. And I don't know if you're able to copy those, Dawn, or if you want me just to put those in the chat box in a moment, which I can do also.
Okay,
or
yeah,
email them
put 'em
to
in the
you.
chat box or email them, either way.
That's great. Okay, great. And then, so this is what we've seen from families. We've gotten about 250 assessments from kinship families thus far within our counties. And kinship families by far are saying their biggest need is financial support. They need help with financial services. Second, and that's, as you can see, about 33% of the families are saying that. Second, about 15% of the families are saying they need legal aid. And then from there, childcare, access to childcare, help with home maintenance. And then the bottom of our list, and we ask them about 20 things. So these are the top have about 20 options to choose from. And then respite care and help with their children's specialized needs. So these are children who have specialized needs. Maybe they need special equipment, medical equipment, things like that. Families are saying, we don't have access to that, and they need it. Families are also saying that these are the supports that will help their family thrive. So this is kind of different. I might say, a support group would really help me thrive, but it's not what I need. So this is kind of just worded a little differently. And it's interesting that we got different answers. When we say what will help you thrive as a family, legal aid, that's their number one need. Access to childcare is next. And then third, we see support groups. Fourth, we see training on trauma. And then fifth, we see just someone to talk to. It doesn't even have to be a support group. If I just had one friend who understood what it was like, because one of the things we hear from kinship families often is how isolated they feel. They're raising their nieces and nephews, they're raising their grandchildren, and their peers, their friends who have been longtime friends. They don't understand what that's like. They're not doing that. And they're in a unique situation. And the family guilt dynamic is another unique situation of a kinship caregiver. They have a lifelong bond with this child or brother or sister that is experiencing this hard time in life, and it's the reason they're raising these children. And a lot of guilt. Grandparents experience a lot of guilt when they talk about the problems that their children are going through, and understanding that that's not on them. That's hard. That's a unique situation that not all families obviously experience. So kinship families have to say about their current support levels when we asked them, who do you have? I'm so glad that 40% said I have 2 to 3 people. 10% though said I don't know anyone that I could ask for help if I needed it. And 16% said I might know one person. So those are pretty shocking and sad numbers. If you ask me, it's about a quarter of the puzzle that doesn't have someone, or a little over a quarter of the puzzle. And then finally, how stressed are kinship families? And we're glad that there's this 10% that's low stress, but really about 30% of them says I'm high stress, but I'm coping. 20% says high stress and I'm having difficulty coping. And then 10% says I'm completely overwhelmed. And when we asked, what's interesting, and I don't have this slide, but when we asked kinship caregivers, this is what they said. When we asked the workers who worked with kinship caregivers like yourselves, the numbers were far more on they're overwhelmed. They're just not saying it. They're overwhelmed. We do have another meeting just right around the corner next week. So if you want to learn more about what we're doing, where we are in the process, we have these quarterly engagement meetings. Where our next meeting is June 9th. We're actually just turned in our third quarter report to the state, and we're looking at jumping into the implementation process for next year, which would launch in September, and no longer gathering data and researching this program, though we are already connecting them to support groups and services. Then we'll really be collecting the data of this is the program that we're running and this is what it's doing. So that's an exciting thing. And we'll continue to have these quarterly reports, engagement meetings to share with our community stakeholders and the organizations that support us, and just to share what we're doing, where we are in the process, what we're learning, and what's happening, and to get feedback as well, so that we can hear the voices of kinship caregivers from them and from the people who serve them, because sometimes, it's a different perspective, and we appreciate that. So if you'd like to be involved, we'd love to have you. And I think that is my very last slide. So I don't know if you have questions. I would love to answer them if you do.
Okay, Rebecca has questions. Okay. Of course.
I know ACH is involved in other areas. Can you explain what ACH is and what role? I mean, I understand your role is to get this program started for kinship care, but tell me a little bit about ACH and what all they're involved in.
Yes, everything. And as being there in November, I probably don't even know everything, but ACH is like I said, we have the counseling services. There are emergency shelters, as you know, safe places. If you've seen the safe place sign, maybe at a QT or a public transit system. So we have the emergency shelter for children who are picked up through Safe Place. We also have behavioral health programs and residential services for children. We partner with, or not partner with, a division of ACH is OCOK, Our Community, Our Kids, which does foster placement and adoption placement. So really just program services for at-risk youth. And there are, like I said, behavioral health, residential services, the foster and adoption services, the emergency shelters, the free counseling, life skills groups, life skills classes, parenting training courses, referral services for, resources. And then, of course, the Kinship Navigator and Kinship Connection as well. So we have a different program, very similarly named, called Kinship Connection, which is working towards permanency for families that do have open cases. So families who have open cases who are working to become permanent foster kinship, not foster kinship parents anymore, but permanent kinship parents, they're helping to do that transition with them as well.
So I know in your situation, it sounds like CPS is no longer involved. They just kind of said, oh, we found them a safe place and we're done. Are these services available to families who are still involved with CPS, or is it just people who are not involved through CPS?
No, absolutely, for both, all kinship families. So we know that the need might be a little greater for a family that doesn't have a caseworker. They might have less access to services, but we want to connect all of those families, because even the families with an open case, it really just depends on their caseworker, right? How many services they're connected to, and they're not being connected to other peers. They're not being connected to support groups. They're not being connected to TBRI training. And those are the things we still want to connect those families to.
So the money that pays for these services comes from the federal government, it sounds like?
Well, ultimately, yes. So the Family First Prevention Act gives federal funding for states to create to have an evidence-based program. Right now, there are no programs that are evidence-based, so there are no programs that are accessing that federal funding. But we right now are operating on a grant through DFPS and through the state to plan and create this program that ultimately the goal is to become federal funded. Yes.
Do you offer any services to immigrant families? With all these children coming over the border?
Right.
Finding family kin to take them, but they also have the needs for many of the services you're providing.
Absolutely. So it's one of the things with our Kinship Navigator program that we've really been working towards is what can we provide for undocumented families? So I don't know if they can access our counseling services through ACH with being undocumented. That is a question I would have to get answered for you and get back to you. And I can send that to Dawn when I find out. But as far as finding churches that provide respite care, like parent nights out, or that do counseling services, pastors that do counseling services through churches, things like that. We really have been working on trying to find, and that's part of one of the things that's in our resource guide, not just for undocumented families, but for families. Often we see, for example, a grandmother who might be raising her grandchildren who mom lived there for a while, and then mom's been gone for years, but she has no legal paperwork. So she needs access to those kinds of services and has no legal paperwork to get them. And so we're trying to find, places that will serve them in those kinds of capacities. Also, I have found a couple of pro bono, low bono lawyers, legal aid services that will work with undocumented families as well. So we do have some, but that is still a hurdle. And I think will always be a little bit of a hurdle.
I have a question. So on your different graphs and stuff, you mentioned legal aid being a need that families families identify. Is that kind of what you just talked about, like getting legal paperwork for the kids? Or is that like, we're wanting to be the long-term caregiver, we want to get an attorney to intervene to get custody? Like, what all is included in that they're asking for help with?
Yes, all of those things. So we're hearing families who just want to get a conservatorship, is what we call it in Texas. They just want to get conservatorship. Families who, like I said, maybe mom's disappeared for a long time. They don't even know where to start. They don't know what to do. And families who want to adopt, all the way, us, for example, we want to adopt, we want to start that process. But the problem with so many, it's a lot of the legislation that's actually, there's several bills and legislation right now that, for example, for getting legal aid of Northwest Texas, or getting legal aid for so many of these places, they have to qualify financially. Well, houses and cars are included in that qualification. Unfortunately, grandparents, for example, who might be on a fixed income, but they had a nice house and they had a nice car. Well, now, unfortunately, in order to qualify for the financial aid to help them adopt or get conservatorship of their grandchildren, they might need to sell that house and sell their car, because those are listed as income right now. There's some legislation hoping and trying to change that. Same thing with being able to get SNAP or TANF benefits. Medicaid doesn't really qualify because everybody can get Medicaid, but those kinds of things. So those are the legal aid questions that we're having. Families who might have spent $10,000, $15,000 already trying to get custody of their children, grandchildren, and they're tapped out, they're maxed out, and they need help. They need somebody to come alongside them and help with legal aid. So yes, all of those things.
Okay, thank you.
Yeah, no, absolutely. And really that's been part of the battle, is just connecting to the Texas Bar Association and to lawyers, and trying to find people who will come and do, low bono or pro bono legal work for families, just to help them out.
So are those resources by county, specifically what we're talking about legal? It has to be within Hill County attorneys that are willing to.
Right. Yes, they are by county. Yeah, for example, I have one great, wonderful legal aid who only can serve Tarrant, Johnson, and Parker County out of our counties. And so when you go into the resource guide, once that's up and posted, and I'll make sure Dawn has the website, you'll be able to click on your county and then click on the resource that you're looking for, such as legal aid.
These counseling services and the parenting and life skills services, TBRI training, are those also specific by county?
Sorry, I thought my dog was about to bark. So I put it on mute. Yes, but really ACH serves through the counseling services are real help for real life, which is what does those life skills and counseling services, group therapy and family therapy. Though that service serves Johnson, Tarrant, Parker, Palo Pinto, and Hill. So anybody within those counties would have access to real help for real life. And we have counselors in Hill County. And because of the pandemic, which has been kind of a blessing, I think, of the pandemic, we've moved so many of those services to be virtual. And that's something that I think that we're talking very seriously will probably continue on, especially in our more rural counties, because it's hard for families to get to, an office. And so that's a service that'll continue on for that to be virtual, which is really quite nice.
And Annette is still the counselor here for Hill County.
Yes, Annette is wonderful. She's great.
She used to be down the hall from me when I was over on Franklin Street. And so we probably had more, it's kind of out of sight, out of mind, because she is kind of tucked away over there.
Yeah.
I'm not sure where she's going though. I heard they were moving everybody out of that building. So.
Oh, I have no idea. That's a good question. But she's the one who said, I will continue to fight for these services to be virtual in Hill County, because everybody can't make it to Hillsborough if you're in,
Whitney or, yeah.
Yes, I was trying to, can't even think of a county that's far. But yeah, I mean, a city that's far, but yes. So she's the one who said that that's something she's going to be fighting for to continue in Hill County because she sees the benefit of it. She's a great advocate for the county and love her.
All right. Anything else?
I feel like I've just talked 1,000 miles a minute.
Well,
I hope
that was,
All good information.
yeah, that was the point. You were
Yeah,
supposed to
don't get
come and share all
information.
this with us.
Yeah.
So, I think, everybody's asked all the questions that they have. So,
I have one more question.
Oh.
Would you mind sharing your slideshow with us?
oh, sure.
Do you have like
Absolutely.
an update or something you could share with us if you don't want to share that whole thing?
Oh no, I mean, I don't mind. I can email it along with the links, and I can email the form for referral services for our Real Help for Real Life for those counseling services. So I will send that along with the slideshow and the survey links. And I feel like there was another thing that I was supposed to send. Oh, the website. I'll send you our Kinship Navigator website link as well. Right now it's decently bare except for the registration for the engagement meeting on the 9th. But as soon as those resource guide and what to expect guide is up, we hope that you utilize that to help serve your families.
okay. All right, Chantel, thanks so much for coming and doing this for us, letting us know about your program. And I think certainly, you know, we bump up against a lot of those kinship families. And we get a lot of calls here. Tina will tell you, we get strange phone calls here. People calling and saying, you know, hey, I need help, you know, so it's nice to have a place to refer them to. So,
Yes, yes.
Yeah, absolutely. And my email, you know, Dawn, you have my email and my phone number's at the bottom in my signature line. Please don't hesitate to share that with any of your volunteers or workers. Email me, call me anytime. I don't mind. Happy to be referred any family that you have.
well, the email that you send with all the links and the slides and everything, we'll pare that down a little bit, but we'll share that with all of our volunteers. So
Well,
to make sure they have all that.
Okay, great. I appreciate your time. Thank you so
One more
much.
question, sorry.
Yep.
Yeah.
I was just looking at your website. So it says to benefit kinship families raising grandchildren, nieces, or nephews in those 5 counties. What if it was like a what DFPS calls fictive kin, if they are not blood related or if they do not fall in one of those
Yeah.
categories? Does that still qualify?
It does, absolutely. And I appreciate you pointing that out. We need to change that wording.
Okay. Sorry.
But yeah, absolutely. A cousin, a close friend, a fictive kin. We actually have one woman who's raising her little boys, 2 little friends who came to spend the night and never got picked up. And she's been considered fictive kin by the state and is continuing to be foster parents for them. And she's, you know, walking the journey and we're walking it with her. So
yeah, good.
Thank you.
So.
All right. Thank you, Chantel. We
Thank
appreciate it.
you.
thank you.
Bye-bye.
Bye-bye.
I know about